How is mental health stigma relevant to the vulnerable group in your e-mental health project?
Yeah, absolutely. Also for Horizon and Smile. Stigma is very relevant for our target group. If you think, for example, children and adolescents who are in the critical development stage and may lack language or agency to articulate the stress that could be escalated in the more challenging issues. And for young adults that are in the transitional phase to independence, often experiencing stress for a job application or maybe for the university career, identity shift and life instability. And if you talk about some subgroup with additional vulnerability, like for example people with a low socioeconomic status, migrant backgrounds, and rural or remote youth, LGBT+, or those with limited digital literacy. Why stigma is highly relevant for our group? I can synthesize in 4 points. The first, stigma as a barrier to early health seeking. And the research consistently shows youth are least likely to seek help from professionals due to fear of judgment and shame or being labeled like mentally ill. And adolescents may internalize in the other way messages like I should be strong, or others will think I'm crazy or I'm not serious enough. So in the SMILE target group, stigma directly leads to underdiagnosis, undertreated symptoms, and especially social isolation. And the second point is the intersectional stigma, a compounded vulnerabilities, because this double burden can result in silence, in mistrusting services, in digital disengagement if content feels irrelevant or judgmental. So if youth facing additional social barrier, experiencing layered stigma, both general mental health stigma and stigma linked, for example, to identity or background. And this is why interventions must not only be destigmatizing, but also culturally sensitive and inclusive. The third point is a stigma transferred through adults and system, because teachers, parents, or peers may hold stigmatizing attitude, discouraging open conversation. Even well-intended professionals can medicalize or moralize distress that can reinforce shame. And this is why SMILE acknowledges this by including educational component for parents, for teachers, for educators, but also for policymakers. And final, regarding to the use of digital tools. In mental health, stigma also influences how youth engage digitally, because they may avoid, for example, apps or digital tools labeled mental health. They prefer, for example, something framing in the name of well-being or life skill. There are another concern regarding the fear of data privacy breaches or being tracked also feeds stigma-related avoidance. So, SMILE would address this kind of problem, use a low threshold, privacy preserving, youth-friendly digital design. So in our project, stigma is at the core of our intervention to be addressed. Thank you.
How can digital tools reduce bias, structural barriers, and the need for patients to retell their stories?
I can address this question, so thank you, Peggy, for providing us your question, because in our project, the challenges to realize program at the institutional level require the stakeholder involvement at different levels and increase the awareness about the issue. This is not for today, but also for the future, because if we address the resilience of adolescents, we want to create a more resistant society for the citizen of the future. But it's important for policymakers, they have evidence-based, so to create program. Without evidence, policymakers are not so confident in create or addressing funding for this kind of project. Because we know there are some fear about digital tools, but it's important to create education in how we can use digital to offer the best solution for the problem, which is in this case mental health. So first of all, increase our evidence-based.
Low threshold of accessing e-interventions and normalizing symptoms of mental health may both be strategies to overcome stigma associated with mental health problems and treatment. Is this something that happens in your projects, and what may be the benefits and risks associated with that?
Maybe Vincenza, do you want to say something first?
Absolutely, because both these strategies are very central for our project, because by providing a low threshold digital platform, young people can access self-assessment, monitoring tools, and gamified intervention that are the features that are useful to use during their period and in the location privately and without barriers, which help reduce the fear of judgment or encourage them to an early engagement. So, by avoiding clinical labels like treatment or disorder, young people feel more comfortable engaging with this kind of tools. And regarding the self-improvement, wellness, rather than a mental illness act, it's important the language, as Annette before said, that could increase the reach and uptake of this kind of tools. And the low threshold entry allows early access before symptoms escalate to clinical levels. So the empowerment and the self-efficacy of this kind of strategies that normalizing everyday distress help users see mental health as a part of general well-being. It's not something to be hidden. It is encourage the self-management and agency. So people say that it's okay to feel in this way, I can do something about it. So take awareness about the importance of their mind, the message that their mind could give people. So, and it's important to stop and in your private room in the morning, in the afternoon, or maybe in the night, because adolescents stay awake also in the night when they have some troubles, and they have something in your hands, but a good instrument that is validated by project, and so the feedback of stakeholders is very important. It's not just a tool that adolescents use in an improper way, because this tool is co-created with the teacher, parent, healthcare professional. So this is the right guide. But it's important to mention also the risk. So normalize the mental issues have the risk of trivializing serious symptoms, because over-normalization may blur the line between common stress and clinical depression, clinical anxiety that is worth to be treated. So users may delay seeking professional help because they assume it's normal or that by myself I can manage. And to mitigate this risk, I can suggest to include the clear escalation prompts in your digital tools and integrated referral pathway when this alarm or alert could be active. So another risk I can mention is mismatched expectation, because users may expect full treatment but only receive psychoeducation or cognitive behavioral therapy for light or moderate anxiety or depression, and this can cause disappointment and disengagement. So the mitigation of this risk could be communicate clearly the scope and limits of the intervention in a transparently way at onboarding. And so the last point I want to highlight is the potential medicalization backlash. So when we normalize this problem, these issues, yes, it can reduce stigma, but also encourage over-identification with the mental health labels. So everyone is anxious. So I have a disorder? No. So we need to emphasize the spectrum thinking and resilience building, not pathologizing. So just to create a framework where mental health is something the people have to take care without thinking about pathologies. This is so just something.
Yeah,